Okay, so we're gonna look at the Dental Explorer. So this is the 1112 Explorer. We use this for checking for calculus deposits on the tooth surfaces, abnormalities on the tooth surfaces, dental caries, so those types of things. So when we are exploring the posterior teeth, we are going to first determine if we have our correct working end by sticking the tip of the instrument in between the premolar teeth. So I'm going to take the working end and stick it directly between the premolar teeth and look to see, is the terminal shank here parallel to the side of the premolar, and there, yes, it looks parallel. Then I'm going to flip my end just to check, double check and make sure. I'm going to stick the working end into the contact area. Is the terminal shank parallel? No, I can see my terminal shank here is wrapping the tooth. So the opposite end would be the correct working end for this posterior segment here. So for all sakes of demonstration, I'm going to show you more in the premolar anterior or premolar area, closer to the anteriors, just so you can get a good view of what I'm going to do here. So I'm going to make sure that my tip is pointed towards the distal surface that I'm going to be working on. I'm going to go to the distal line angle. I'm going to tilt to insert my tip under the gum, and then I'm going to pivot up onto my fulcrum to parallel the terminal shank. Then I'm going to start taking my rocking strokes, rock, 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 roll, 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 and then pivot on the fulcrum. It's got some calculus on the distal aspect there that I was getting caught up on. Now I'm going to come out, turn my tip to the mesial direction, come back to the distal line angle, insert on that distal line angle, and then start taking my rocking stroke. So it's rock, 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 trying to keep that terminal shank parallel to the tooth surface that I'm working on, rolling into the contact area. And I'm not sure if you noticed, I'm going to do that again. So I did a pivot there on my fulcrum from here to here as I rolled interproximally. So it's a combination, again, of the rocking, the rolling of the instrument handle in my thumb and index finger, and the pivot on the fulcrum to keep that adaptation and keep that terminal shank parallel to the tooth surface that I'm working on. Now I'm going to shift my fulcrum slightly